apologies for my unavoidable absence, and thank you for choosing to spend time with us today. We appreciate how busy you are, and as such, we are always excited to make new links and welcome people into the IOL community. We are at the forefront of training and learning when it comes to healthcare leadership, paying particular attention to the issues that are important to you and ensuring we attend the specific needs of you. Indeed, it is our privilege to work with and develop future health leaders, many of whom you will hear about from today, and thank you especially to them. People come to us because we are specialists in healthcare management. They come because we have a passion for applying higher learning, the latest ideas and cutting edge techniques to the challenge of healthcare organisation and leadership. They come because, like us, they understand the place that effective organising has in improving human health and well-being. We can only make those improvements with you, and together we can test ideas and learn. We can explore new possibilities, extend knowledge, and innovate to overcome complex problems. Together we can advance your knowledge and skills and learning from each other. The first step in that journey is here today as you get to know the Institute of Leadership and we you. And my apologies once again for my unavoidable absence, but I have left you in the very best of hands. Have a good session, warm wishes and stay safe. Robert McMurray, Academic Director. So thank you very much, Robert. So now I'm going to hand you over to Kathy Doyle, who's our Programme Director. So Kathy has been a Programme Director for Year 2 Healthcare Management and Quality and Safety in Healthcare Management. We're delighted to have her today as she's a ray of sunshine. She brings great high energy and great buzz about her. And she's probably one of the most, the best qualified person to answer some of your questions. So Kathy, delighted to have you on board. Thank you so much. So I'll hand it over to you.
Amy, thanks for that lovely introduction. And thanks also for the slide here, which talks a little bit about myself. As you said at the outset, I'm the Programme Director for Year 2 on the two programmes that we're discussing today, the Healthcare Management Programme and the Quality and Safety in Healthcare Management programmes here in Ireland. Additionally, I'm the leader of modules across all the programmes that we run here at the Institute of Leadership. I come to academia with lots of experience of having worked in healthcare, not as a healthcare professional, having trained as a healthcare professional, but on the management side of the house, working very closely with healthcare professionals. In my career prior to coming to the IOL, when I was the Corporate Services Manager at the Dublin University Hospital, and I worked there for 14 years. So it gave me a great background. And I believe that wonderful experience I had working within healthcare is complemented then by my experience in academia and my learning and what I can bring to the programs and our students. So what are we trying to achieve today? And there's two things I suggest, and perhaps at the end of the session we realize there's much more than two things. But first of all, I think that we're trying to achieve that we're going to hear from 5 great students who are currently either in Year 1 or Year 2 in our programs. And we're going to get some insight into their experience of having studying and making friends and colleagues as part of our programs at the Institute of Leadership. And then I suggest also that the second thing that we're going to achieve is that any questions and answers that any questions that you may have as you hear the students talking, or perhaps maybe another question a different student asks, you may also be thinking of a question. We would love to spend some time at the end and reading through your questions and looking at some answers. I think that's from me. I'd love to call on Jamal now, Dr. Jamal Hashim. If Jamal would like to open his microphone and turn on his camera, it'd be lovely to see you, Jamal.
Hi.
Hi.
You.
And Jamal, yeah. Did we think we were going to meet each other again?
Yes, it's good. It's good. It's good to see
And
you
it's good
again.
to see you as well.
I'm just trying.
Sorry, Jamal, my apologies.
No, I'm just trying to adjust my headset so I can so I can hear you.
Okay.
Um,
Um, I'm
yeah.
delighted and honoured to say that uh, Jamal and I, our paths crossed when Jamal was a first year student on his second module of healthcare management. And I was there as the module leader, delivering on operations management and quality. And Jamal, you made a super contribution in the class, uh, where you first learned of these new healthcare management related concepts, and the application of them to case studies. So, and it's wonderful now to see you again this afternoon. So I have a few questions I'd love to ask you, Jamal. So what made that healthcare management course at the Institute of Leadership, what made that desirable to you?
Thank you so much. So, my background is originally in vascular surgery, and I worked in it for 8 years, and then I decided that I want to take my career in a different direction, and to work in medical education and to work in artificial intelligence in healthcare. And given that AI in healthcare is still a budding field, I thought that, leadership competencies and change management skills would definitely be necessary to support my journey into this field. Um, and RCSI was my first choice because I graduated from RCSI. It's where I got my medical degree, and I'm delighted I made that choice. If I could just address the audience for a second, could you guys raise your hands if you come from if you're a healthcare professional, if you work directly with patients in any capacity? All right. So we have a few hands up. Thank you guys very much. Now could I ask you if you come from a background of on the management side and on the administrative side, would you mind if you raise your hands? All right. So and this is representative of the mix of people that you're going to interact with in the program. So it's going to be people from both sides and more of the healthcare continuum. And the reason I asked you guys what your background is what I've come to realize through this journey in the master's program is if you come from if you're a healthcare professional and your job consists of dealing with patients directly, then what you're going to gain is a new thinking hat as to what happens behind the scenes and how you can influence all of these things, and you're going to learn how to and it will be almost from module 1 you'll start noticing things about your work environment, and you'll start trying to influence little changes here and there, and as it builds up, your change management competencies will increase. And if your background is more on the administrative side, then you'll get a new thinking hat as well, in the sense of understanding what are the primary concerns of healthcare stakeholders, particularly physicians, nurses, and patients. So, regardless of what your background is, you're gaining a new thinking hat by you know, almost at the beginning of this program, but it will be solidified throughout the program.
Jamal, what you've said there is so meaningful. We talk about having multidisciplinary teams in healthcare. However, often we see those teams only as maybe the clinical teams.
Yeah.
But that patient journey involves many people in the back office, many people on the ground floor, maybe when they register, and that very important part of their patient journey, which is when they meet the clinical staff as part of their care. And here in the classroom, for the 2 years, you've identified in the mix that you've nurses, you've other physicians, you have physiotherapists, you have pharmacists, but you also maybe have CEOs of companies, which are medical companies. You have administrators, you have managers, my previous role, And together you're working as that academic team as part of your program. You're stepping into the shoes, in your case, of a manager to hear things from their perspective. And the managers then are stepping into your shoes as a vascular surgeon to say, wow, I never thought of it from that viewpoint. So thanks. So that was powerful learning. And as you reflected, and that's an important part of your journey, was reflecting. And as you reflected maybe on some of the things that came out of your time with the Institute, that you reflected on that larger multidisciplinary team. Yeah, so another question for you. So what did you like about the course?
So I like that it tackles a lot of different aspects, you know, and it not only touches on them in the theoretical sense, but the assignments that you're given, they're really relevant for the learning outcomes that you're trying to achieve, and they're very, very practical. You know, there's and you know, different people obviously have different styles of learning, and they have different preferences for what they like to learn. My personal preference is always for something practical that can be applied, and you know, that's you know, not in a theoretical ivory tower, right? And so there are definitely theoretical underpinnings that you get to understand, but what I like the most about the program is that almost everything that you learn is, you know, practical, and it's applicable to real life scenarios, and you get ample practice doing that in the assignments. And then, you know, the really challenging application comes when you come to do your project.
Yeah, and if I might just sort of summarize something that you said, the foundation in all the theory and different theories, because we want you to be critical and to think about, well, which theory will fit within my context and my culture, and then applying the theory perhaps in the early modules to case studies.
Yeah.
And then, as you say, when you build up your experience, you build up your knowledge, you build up your academic writing, we then have this capstone project in year 2. And as Jamel, as you said, you know, that was really the icing on the cake, as you might say, as you put that, all you're learning from year 1 and you're learning from as you progress through year 2, and you put it all together in your final dissertation report, which you yourself have only submitted in the last few weeks. So well done. Yeah. Which module was your favorite, say, in year 1? There's a
no, this is
maybe you've no favorite.
This is a pointed question, Kathy. You're
Well, besides my module, which other module?
So I'd have to say, honestly, it was module 2. It was module 2. I'd never thought, you know, so one of the simplest examples, and I can't remember if this was a case study that we read or if it was an assignment that I did, but it was in relation to delays in the operating theater, right? And I had never really sat down and considered, you know, what are all the processes in place that ensure that you actually get the patient to theater on time every time, and you know, how you can take a step back and look at these, you know, these processes, and see how you can improve them, and how that, you know, and let them work synergistically to get a better patient outcome. So that to me was extremely interesting. Just the you know, the drawing out process maps and looking at how they all interlink together. You know, I found that very, very interesting.
Yeah, and process mapping is a powerful tool.
Yeah.
And it's great that, as you say, here we are now 18 months later, and you remember that takeaway from that second module in year 1.
Yep.
So one last question for you, Jamel.
Absolutely.
What surprised you most about the healthcare management course that you've undertaken?
What surprised me the most? So, you know, some of my friends who are not in the medical field have done MBAs, right? And so, you know, going in, my expectation was that this is going to be similar to an MBA in a way, and in a lot of senses it is, but it's geared specifically towards healthcare management. but you also gain the skill of, academic writing, and you sharpen your critical thinking with this, which, no offense to, my MBA friends, when I looked at their writing, it's not because I think, especially in the healthcare field, there's a certain expectation, of the level of academic writing and of the level of scientific writing that is needed, and so this was something that I had was a deficiency of mine before, and I think with the assignments and with all the feedback that we were getting throughout it, and all the writing workshops, it improved significantly.
And you've just prompted me on something. Like when you're in medical school or as part of your training, you often may not get the opportunity to write a long assignment, which could be 5,000 words.
Yeah.
And you take a deep breath, you say, well, where do I start? But the resources that we provided you with, the academic writing resources, the academic writing workshops, etc., to hone those skills. And all through your modules in year one, you were honing, you were learning from the feedback. So when it came to write that bigger piece of work in year two, you were nearly ready to take that on board.
No, I absolutely agree with that.
Yeah. So because all of our students have worked in the area of medicine and healthcare, we're aware that their previous training may not have had the academic rigor. So hence, we do not let that be a barrier to the students. From the get-go, as part of the orientation at the very beginning, we start with those academic workshops and academic writing and how do you paraphrase, etc., to build the skills in the students.
Yeah.
Jamal, it was super talking to you. Oh, did you want to say something before we close?
No, I was just going to tell the students that you would be surprised how much you improve in your academic writing skills as the course progresses.
Thanks so much, and it was wonderful catching up again. And congratulations on submitting your final year 2 dissertation, and good luck in your future career.
Thank you. Jamal. Thank you very much. Thank you for having me.
So please stay online. I'm sure we'll be chatting later.
Absolutely.
Now I call on Rosita, please. So Rosita, could you open your microphone and turn on your camera, please?
Hi, Kathy. How are you?
Hi, and lovely to see you. Rosita, would you like to tell us a little bit about yourself, please?
Okay, so I am Rosita Gaidra. I am the head of Health Informatics and Clinical Coding within the RCSI Hospital Group. I am a year 1 student, so we're just wrapping up year 1 here at the moment. And yes, so I had chosen the course. My sister had previously completed it actually, and she spoke very highly of it. So that was kind of my motivation initially to get into it. But yeah, and I obviously chose it because I work within the RCSI group. So.
Yeah, and I know your sister well, so I'm really showing how long I've been here at the Institute. Yeah, and can I say the beautiful project that she did in year 2, it's still rippling through healthcare in Ireland. So well done to her. Yeah. So Rosita, it's great to have you on board, and thanks so much for being here this afternoon. How has year 1 benefited you?
So for myself, obviously, I am in more the management and the administration side of healthcare. So the tools that I suppose that we learned, and the same as Jamal, module 2 specifically, because it's very operationally driven from a practical stance to be able to actually apply them from the day to day. So they have definitely benefited my day-to-day piece. And then just, I suppose, general learning skills that you pick up in each of them, like things like risk management, strategy, reports, all of that kind of stuff. They're all refined as you go along. And also, like Jamal said, as soon as you kind of enter into module 1 and you start to learn about, leadership and power and culture, you do start to apply it and think about it in your surroundings and how you can see the dynamics within departments or teams operating and how you can then maybe influence them. So even if you're kind of entering into a negative environment, how you can improve that, or how you might have a better understanding in the background pieces of the power and culture that play a role. So yeah, it has benefited hugely, and it's only year one, so that has been good.
And then the flexibility in year one in how the program, now that we're totally online, how the program was run. How did that fit with your work and life and home and everything?
It suited my work life fantastically. I have 2 small children, so actually the whole course being online has been of a huge benefit to me, because I have just been able to do it all upstairs. I didn't have to worry about traveling in and out to the campus, and the supports and the resources that are there have been fantastic. So everything is so clearly labelled. It's so clearly signposted within the Moodle system that's used. It's very, very accessible. The responses in terms of if you have a query, the team, the staff, they're so good to get back to you. So it really, personally, I haven't felt obviously the loss of being in a classroom, because our year started, it was all online, whereas I think the previous years kind of had a mix in 2019. But it has been very well supported, and I definitely couldn't complain anyhow. So that has been quite good, and the flexibility is great. So but even from the point of view of, we've had huge pressures within the acute services, obviously with COVID and most recently our cyber attacks. So just even the pressures that it has put on people in completing assignments or getting workloads done. I noticed from speaking to a couple of colleagues that they've had to look for extensions, and that flexibility has been provided as well, because obviously, I mean, some of the external factors are completely outside of our control. So
yeah, and as you said, this year, I'm calling it this year, it's actually the last 18 months.
They've all run in together.
Have been very strange times. Jamal earlier, he spoke about one of the things that made the course desirable to him was that when he started the course, meeting people, himself as a vascular surgeon, then meeting people on the management and other side of the house. So yourself on the management side of the house, as part of the course, when you met and you heard from healthcare professionals and their perspective, I suppose, on life and healthcare management, how did that resonate with you?
Quite interestingly, actually, because I up to this date, I've only met one other person on within my group in healthcare management that is in the administration side. Everybody else has been clinical, so it has been very eye-opening to get their take and to see their perception on the processes, or how decisions get made, how finance decisions come through, you know, and just to see how it impacts on their end as well, or so just they're completely different, even though we all work together, but the views and the perceptions are quite diverse. So it has been very good and very beneficial, I suppose, moving forward, and been able to apply it, because you do have the insight of both sides now. And that has been good. And equally then from a knowledge sharing perspective, particularly around looking at processes and looking at how services are delivered. And while I could suggest that, oh, well, if we would just move this, that would be fine, but not being aware, let's say, of the knock-on effect from a clinical standpoint of view, it has been very, very good. So,
were there any surprises? Like, had you expected something and something else happened? Or and maybe in a positive way.
Oh yeah, definitely. I mean, I'm surprised. I enjoyed it so much, to be quite honest. That would probably be the biggest surprise. I knew it was going to be an awful lot of hard work, but I have thoroughly enjoyed it, which I didn't expect. I obviously expected to enjoy it a certain amount, but I have really enjoyed the learning behind it. And like Jamal said, the assignments are very practical. So you're bringing them back to your day-to-day, so they become your own reality, and you're basing it on that. So it is beneficial. So it's not an assignment that doesn't have merit. So obviously you get your result and the end of it, but you do get to analyze something within your own area, and you have continuous learning throughout the course as well that's applicable to your day-to-day. So that was definitely a surprising part of the assignment end of things.
Jamal talked about process mapping as just one takeaway he had. It's a very practical takeaway. of the 6 modules that you had as part of your year 1, is there one practical, or maybe not so practical, takeaway that you said, yeah, that's something I found very helpful in the workplace?
No, and I think module 2 might be getting another gold star here as well. But obviously I come from an informatics side of things and the operational end. So module 2 for me was very, very beneficial. Now, in saying that, I had gone into it with a different expectation. So I wasn't really expecting for it to be about measurement, SPCs, looking at the likes of process mapping, but they are all tools that are so applicable to the day-to-day and how you can improve and make things more efficient, streamline services. But equally, you are given a wealth of knowledge that you can be a little bit overwhelmed with, and I'm never going to use all of these, and you won't use them all together, but you definitely find yourself applying them, here and there, when you go to actually assess situations. So I would have to say, yeah, that module 2 was definitely probably my favorite. Yes, yeah.
And the word measurement, yeah, I'm delighted you said that. Because how do we know something is an improvement? How do we know unless we collect data and we measure?
Yeah, it's crucial.
And it is so crucial. So, and knowing what data to collect and why we're collecting it and measuring it.
Definitely, and it raised my own awareness in terms of how you can measure all of the other bits and pieces that you put in. So within my area, within clinical coding, measurement is definitely, it's very straightforward. There is an auditing tool, it's already established. So that measurement piece is continual. But when you look outside of that and, the practical application of how do you measure something that you've implemented, the module was so helpful in actually identifying areas that you can use. So that was good.
Now, you mentioned risk management, and I know that's module 6 on the health, or it's an element of module 6 on the health management program. And so look at the theory and learning that you took from that module also.
Well, absolutely. And in the current situation of the cyber attack and assessing, let's say, the impact of it on our third-party systems, how that has all come to fruition. And I suppose the things that on one level we hadn't kind of factored in before. So the risks that have been identified through that, and I suppose the processes that we now have to go and put in place. The module was very well timed.
Just serendipity, yeah.
Yeah, absolutely. But no, it's been very informative. And like that, I mean, the HSE has a whole framework that you're able to apply, but even the knowledge that that's actually there and so user friendly that, you could just actually pick it up and have a look through it and be able to figure it out. So that was good.
And then if risk management wasn't part of your brief, what that module would have done is it would have given you the language of risk. It would have given you an understanding, as you say, the processes involved in the risk management framework or the ISO 31000, which is based on, and knowing the type of questions or listening.
Exactly.
When people are talking about risk.
Yes, the entire 6 modules give such a broad overview to healthcare management, which is what had on one level drawn me to it as well. There's 6 core components that you can apply in your day-to-day, and like you said, they give you the language, the understanding. It may not give you the in-depth knowledge of somebody who works in it every day, but it gives you that awareness that if you see something, you know what to do about it or who to possibly contact or make aware. So they're definitely versatile, they are applicable, and they're beneficial and they're transferable. So I mean, even if you move on beyond the healthcare sector, they're not, even though it is healthcare management, they are all tools that you can bring to, I think, any profession, and it's definitely beneficial. So if you're not sure that you're going to stay in healthcare, it's still a fantastic course to do.
I think that's a lovely way to finish up, and thank you. I wish you the best of luck and fingers crossed for your results, and I look forward to welcoming you to year 2.
Okay,
so
thank you.
It was great meeting you. And cheerio. I'm now going to call on Padraig Corbett, please, if you'd like to open your microphone and turn on your camera.
Hi, Kathy.
Hi.
Good afternoon, everybody.
And it's great to see you. And Padraig, you're the first student here who's studied the quality and safety in healthcare management program. So if I maybe start with the question that I started with Jamal. So what made the course desirable to you? Why did you decide to do the quality and safety course?
Yep. So I'm a pharmacist by background. So I worked in community pharmacy for a number of years, and I now work in the PSI, the pharmacy regulator. So we regulate the professional practice of over 6,500 pharmacists in Ireland, and also over 2,000 pharmacies. So my role there involves visiting pharmacies and assessing the quality of the services that are provided. So from my point of view, I wanted to make sure that the tools and the techniques that we use to assess the quality of pharmacies are consistent with evidence-based practice, and that they are up to date and, you know, robust, I suppose, in ensuring patient safety. So the course was very appealing to me in the sense that there was the 6 modules in the first year, which focused on, you know, an introduction to quality and safety, tools and techniques for quality, for assessing quality and safety of services, evaluation, measurement and research, accreditation and standards. So standards was something as a organization we were just getting into. So to get the theoretical and the practical basis behind using standards in healthcare was also very appealing to me. And then I suppose the module on leadership and strategic management and clinical governance. So there seemed to be something in every module that I felt was relevant to my work and which I could apply to my day job.
Okay, yeah, and what you've just given us all there is that whistle-stop tour through year 1. So you completed year 1 successfully, and then you joined me as the program director for year 2. And
yeah,
that learning from year 1, we often say year 2 is your capstone project. So you bring those foundations from year 1 into year 2. So how did you find year 2 on the program?
So yeah, I suppose a big difference between year 1 and year 2 for me was that the first year of the program was predominantly in the classroom, and then just at the end of module 5 in year 1 we had to move to the online and the virtual environment. So that in itself was a change, and then the entire of the second year was delivered online. So I suppose initially adjusting to the online environment was a change for the end of the first year and the start of the second year, but a very easy transition, I think, for all of us involved because of the support and the help of the IOL staff, and you know, I suppose all of the resources that were made available to us. So great support to navigate the virtual learning environment, great support to access the course materials, how to log in if we were having technical issues. So the transition from the classroom to the online classroom was very smooth. And then I suppose the second year, bringing all the knowledge and the learning from year 1 and how easy it was to apply to a project in the second year. But I do feel that a lot of the things that I did in the first year, they helped me to develop my confidence to go on and complete the project in the second year. So even things like we did the Dragon's Den in module 5 in first year, which was, you know, presenting a case to a board basically as a team to try and get support for a quality improvement project that we were planning to do, and having that experience and being able to apply that in year 2 to senior management in my own organization when I was completing my year 2 project. So I think all of that, having that behind me from the first year, really built my confidence to be able to go off and take on the project in the second year then.
Yeah, and if I might summarize what you said, you talked about maybe those technical skills and technical learning through each of the different modules and what you learned as you were traveling through year 1. Your academic learning and how you became more academically savvy, you could say, as you progressed from module to module and assessment to assessment. And then those beautiful soft skills, the skills around you being a leader within, not of the whole organization per se, but the leader and having confidence in the area where you work, having the confidence to be able to stand up and represent the team at that Dragon's Den, but doing it in a lovely, safe, protected space, which would be the classroom or the virtual classroom. And knowing that other people maybe at the same stage in their journey as they grow as healthcare leaders of the future, and having that lovely protected space to be able to give it a go. And you did it. That Dragon's Den is the students often say that was really, it's really the highlight of the year for them as well. So it's great to hear that you really enjoyed. And then the students on the other program will be really, they'd be envious that they didn't have the opportunity to do a Dragon's Den, and the four of us as dragons there firing questions at you, etc. So that's lovely to hear that memory that you have.
Yeah, no, I think that was a really good experience, you know, to be able to answer questions and to use the evidence base to justify why certain decisions were made, and to be able to stand up and speak up for quality and safety. So, you know, I think that was a very useful experience.
Yeah. And look at the language you've used there, using the evidence base. And that's where management and academia are coming together. So you're not saying why from only your own perspective. You're also saying why because you know the culture in your organization, you know your context, you know your climate. And however, you also know the research within that topic and what it's saying, where it's been successful, where some of the challenges could be, and you bring all that together to the table. And you did a great, you and your team did great Dragon's Den that day. How has the course benefited you? So now you've come to the end of the course. You're waiting to hear your final results, and then your graduation will be in November. So if you just think back, so if you think back to September, October 2019, so what have you benefited? You've talked about some of those soft skills around your leadership, but in a bigger picture, is there anything you say, well, you know, this was a surprise, I hadn't thought about this?
Yeah, so I think probably touching on some of the points that Jamal and Rosita made already about, you know, how quickly you can use the tools and the techniques that you've learned about in the modules and apply them in your work context. So what I did find was, you know, some of the things from the evidence base and from the latest cutting edge research on certain areas of quality and safety, I was able to bring them back to the organization where I work and try them out, you know, and do things on a small scale. For example, using plan, do, study, act cycles, you know, at the start of a project, try it on a small scale, see does it work. If it doesn't, refine it and try it again. So I suppose what surprised me was how quickly I was able to use the tools. So, you know, some courses can be very academic in nature and almost, you know, very separate and distinct from your work context. Whereas what I found what was different about this course is that everything that I learned about in the academic sense, I was able to use it and apply it in my work context, and able to tell others about these tools and techniques as well, which I found was very helpful. And it was, you know, there was learning for me, but there was also learning from everybody in my organization as well, because they were hearing about the latest evidence-based techniques and tools. So I suppose that surprised me. Then as it happened during the COVID-19 pandemic, I was involved in a project to develop COVID-19 operational standards for pharmacies. And so there was a team of 4 of us, and I was able to bring all the learning and the knowledge from the course and apply that to that project. And we developed operational standards for over 6,000 pharmacies or over 2,000 pharmacies in Ireland, and they were rolled out nationally then. So I suppose if I had been doing that project prior to doing the course, I may have been concerned that I wasn't, you know, using the latest literature or the latest studies, whereas having had confidence in researching the literature and reading the literature, I felt that I was up to date with where to get the best information at this point in time. So I think that helped.
Well, can I say congratulations? I know of that project. I know Ireland and your 2,000 pharmacies, they needed very quickly to have some guidelines about COVID. So it was a really critical project. And that was so wonderful to hear that even only having year one under your belt, as you might say, that you were very quickly, you yourself had the confidence to be able to be part of that team that brought that project to reality, and then it was rolled out in 2,000 pharmacists in Ireland. So well done. I've one last question for you, Padraig, and that is, what advice would you give to an individual, people who are listening here this afternoon, or maybe people who will listen to our webinar over the next few weeks? What advice would you give to them if they were looking to start the Quality and Safety in Healthcare Management course?
What I would say to people is, if you have been away from academia for a long time, or if if it's a long time since you've done academic writing, don't be afraid of taking on this course, because in my case, it was about 10 years since I had done an academic course, and in other of my colleagues' cases, it may have been longer than that. But I think given the support around the academic writing, so support from the class, support from the Institute of Leadership faculty, the online resources and the tools, there's plenty of support there to develop and improve your academic writing. So don't let that be a barrier to taking on the course. And I think one of the other speakers today mentioned as well about the feedback from the assignment. So you do get very detailed and helpful feedback on every assignment that you submit, and that helps you to develop your writing, and you see an improvement in your writing when you look back at some of your earlier assignments from, say, year one, or from the earlier stages of year one, and you see how your writing has developed. So definitely, I would say, don't let that be a barrier to taking on the course. And probably the other top tip I would give is to download a reference manager software immediately at the start of the course, because that is very helpful to manage your reading and manage your references. You can use it to highlight blocks of text or make post-it notes on the articles, and that helps you to read smartly as well, because obviously there's a wealth of literature out there, and you could continue reading articles on forever, really. So I suppose what the reference manager software does is it helps you to scan some articles, read the abstracts, make some notes, and come back to them again and flag the ones that you think are most relevant to your area of study. So that would be definitely something I would recommend, something like EndNote or something like that. Yeah.
And Padraig, that was two wonderful tips to give to anybody who's considering coming on the programme. And thank you so much for that. And I never would have thought that concept of having a reference manager to manage your references, to build and use your references again and again as you go through each different module, and you can bring them then to year two with you. The importance of don't put it off. Download that reference manager like nearly within the first few weeks being on the program,
yeah.
and use it with module one, and take the references after that. That was a lovely tip. And you said something there as well that resonated with me, is that I suppose between you within year one and year two, how together I suppose you were there to support and help each other as students. And then the different support that us as academic and operations team faculty that we would have given to you as well. So, and then the support of your colleagues in the workplace. And then I'm so proud when you said that you actually bring your learning back to the workplace as well. So it's very, very well done. That was lovely to hear. So great to talk to you, Padraig. I know now you're waiting for the exam board and to hear your exam results, and then that beautiful excitement in November when we have our graduation ceremony, and you will graduate with your MSc in Quality and Safety in Healthcare Management. So goodbye from me. Thanks
very much. Thank you.
Thank you. I'm now calling on Dr. Shafia Fatima, please. So Shafia, if you could open your microphone and turn on your camera, that would be wonderful.
Hello, Kathy. I hope you guys can hear me.
Oh, we hear you beautifully. Thank you so much. And Shafia, I know that you are a medical doctor. Yes. However, you're also working within the university in Bahrain.
Yes.
So would you like to tell us a little bit about, so when did you graduate as a medical doctor?
So I have, so my journey started as in 2009 when I graduated my medical school. And then for 4 years, I worked in pediatrics medicine. And then I thought of a change in my career and moved towards more academic side. So while I was doing this academic side, I needed to develop the leadership skills. So I learned about this program by RCSI, Masters in Healthcare Management, which currently I'm enrolled in the first year. And that's it. Then I just said, okay, I'm doing this. And to be honest, this was the best decision that I made, because if I compare myself before doing this program, I was put in a leadership position many of the times, but I didn't know how to deal with the people, and how to manage. But this program, it's taught me these skills, and they're really helping me a lot throughout my work life, even my personal life. So I'm really grateful that to RCSI, that you guys have really built this confidence in me.
And that is fantastic to hear. So when I think back to module 1 on the healthcare management program, and I think it was Rosita who talked about how you learned about culture, how you learned about power and influence. So right there from the very start, you were learning in order to manage, you need to know many other things about people, many other things about your organization, about the team that you're working with, etc. So did you find that first module helpful to you?
Yes, I mean, when we started studying the first module, from the day one, I really enjoyed the classes, because all the examples that were given in the classes, that breakout room activities that we used to have with the students, with our fellow students. And that was amazing, because not only that you get to share your own experiences, but you get to learn from other people's experiences. And we had a lot of people from different backgrounds. Some of them were doctors, then some of them were very senior doctors, some of them were juniors, some of them nurses, some of them, in fact, we had people from ambulance team, and it was a mix of team, and we learned a lot from each other. It was amazing.
Oh, great, yeah, that's lovely to hear. And this question I've asked to others, I'm going to ask you. So what surprised you most about the course?
Yes, surprise. Actually, initially when we came to know that it's going to be an online program, because initially when we enrolled in the program, it wasn't sure that it would be still online or would be physical. So all of us were concerned a bit that, how will we do it? We're not going to see each other. But then when started, the way the program ran, the way all the resources were given to us, the time, everything was managed so well that everything became really comfortable and easy for us. And there were all the modules. I would like to tell all the students that all the modules are really important, and from each module you learn something, and it surprises you, honestly. Like when I was learning, again, I would say I'm just like other students, operations management was my best module. Like I enjoyed it the best, and it still stayed with me in that that not only in my practical life I try to see processes. When I even go to a supermarket, I start seeing, oh, okay, what's the process here? How are we managing this? And then I take this, and I discuss this with my friends, and it's amazing. So yes, I mean, operations management was the best subject, and it gave me a lot of confidence.
Great, that's great, yeah. And that the module that 3 of you have commended is module 2. And it is great in laying the foundations also for the other modules. But that very first module around, getting an understanding of organizations and getting an understanding of managing organizations and managing people, particularly on the healthcare management course, it's a lovely first foundation module. And then you look at, as you say, looking operations, managing operations and operations not in the medical and surgical operations, but however the day-to-day running maybe of healthcare, regardless of where you're working. So that was I'm thrilled to hear about that. How has the course benefited you and what you've been able to achieve since you have begun your studies? Now, you shared one story there about going to the supermarket and looking at the processes in the supermarket. any other benefits from maybe the other modules that in your personal life or else in your working life that the course has benefited you on?
Definitely, again, I would add to with the other students that academic. So also being from medical background, we do work in the research side and all, but academic writing is something that we don't do it so commonly. So when I joined towards the academia now, I wanted to learn because I was lacking. I if I had to write something, I would just get confused that okay, how will I write 2,000 words? It's a lot of words. But then when I started the program from the module 1, if I see my assignments from module 1 and now module 6, we are going to submit our assignment just in 2 days, it's a marked difference. Like my writing skills have improved so much that I'm myself and even my family, when I show them, they get amazed that wow, now you can write so beautifully. It's amazing. So yes, I mean, academically, definitely the writing skills have improved, the confidence have improved, the presentation skills. There is a lot that you can take from this program on a lot of aspects.
And that's lovely to hear, that you were very, very skilled as a pediatrician, and you had worked in pediatrics for many years. You moved to education, and now what you bring to your role in education is also that academic ability to be able to write, to be able to read academic journal articles and understand. We use that word argument. What is the argument that the writers are making in their article, so you can pick out the argument that they're making. So it's great to hear that. And as you say, best of luck to you now in your next 2 days or 3 days as you complete your final assignment in year 1 and you submit it. You said that working online, I'm talking about as part of the program, that it has worked for you. The flexibility around how we don't do it in a full block in 1 week, but that we spread it out over 3 weeks. How have you liked that flexibility, and how has it worked for you with your work life and your academic life?
I would go for this break that we used to have 2 classes on weekend, and then we would get a break for a week, and then we'll have another, and then another. The reason behind that is that because it's online program and there are a lot of resources that would be given to you, and so you need time to read them. There is no point going in a class without reading anything, because what from my own experience I can tell you, if you go in the class, at least read some things, whatever the resources have been provided to you, your experience in the class would be amazing. Like it would be much better than you will just go like that, without reading anything. So for that, it's better that it's break in the weeks rather than it all be together. Also because sitting in front of a laptop becomes really tiring, and just doing it every day for next 3 or 4 consecutive days maybe becomes really tiring for all the students. So doing this in the breaks was actually beneficial for us.
And so, it's lovely. It's lovely to hear that you liked the way it was spread over the 3 weeks, and then you had an additional few weeks and you completed your assignment, and then you started your next module, and the whole cycle started again. And Shafia, you just reminded me that because we're now in this the virtual academic world, that we provide material that we would hope that you can have watched and listened to before coming to class. And then we have materials which we present in class. And as you say, if all the days were together in one block, if because of you were so busy in your work life, your home life, you hadn't got the opportunity to watch everything, you would have maybe not had all the benefit. But because it's spread out over the few weeks, it means that you can catch up. You can make the time to catch up with some of the remedial materials. That was lovely to hear. Yeah. How did you find we recorded the presentations each day. Did you go back and listen to them again, or did you need to, or were you always able to attend the in-class sessions?
Actually, I've always been punctual. I've never missed any class.
Yeah, fantastic.
And I would actually advise this to the students that please, if you guys can, if you're going to join this program, please do attend classes because they're lovely. You're going to, I mean, definitely the institute will provide you recordings, but the benefit of attending on spot, and you can ask any of the questions. And I would really like to praise all of the professors because they would be really helpful to answer any queries that you have, and your colleagues would be there. So it's the best thing that you can do to attend the sessions. And I attended all of them, so I used to enjoy a lot.
Well, congratulations. And as you say, being there live in the classroom, live, you know, and yes, we're apart, but live is great. And that's wonderful to hear that you're able to attend all the sessions. And it was great catching up with you. I wish you all the best with the exam board.
Thank you so much.
And your final assignment, and then as you progress to year 2. So
Thank
bye
you.
from me for now. Thank you very much.
Thank you.
And now, last but not least, we have a student who's based here in Ireland. She has just completed her second year with us. So Agnes, she's one of my students. So Agnes Flynn, I welcome you. Agnes, please to open your microphone and turn on your camera. So hi, Agnes.
Hello. Oh, can you? Oh, great. I can't see myself. So there you go. Hi, Kathy, and hello to everybody, and hello to Porrick in particular, one of my classmates and friends. Yeah.
Yeah. No, and Agnes, it's great. It's great to see you. So,
and you too. Good to talk to you today. Yeah.
And so you think back now, Agnes, to first of all, I didn't ask you to tell us about yourself. So your role as the Assistant Director of Nursing and what your brief covers and the amount of patients within the area in which you work.
Okay. Yeah, I work in public health. So I work as an Assistant Director of Nursing in Public Health, and I manage nursing teams over a geographical area. So the teams are divided to provide healthcare to networks, and each network has a population of about 50,000. So we provide the nursing care in the area to that population and lead and manage the teams. And for me, deciding to go on this course, I have completed other courses, but have been a period of time when I had actually completed other courses. And I had taken on this role, and I found myself every day, I suppose, facing challenges and how to deal with certain issues. And I noticed that they were all actually incorporated in the first year of our course. So each of the modules, certainly, then they resonated. I also wanted to do a course because a lot of my colleagues had also completed courses. But I wanted a course that would add value to the organisation and that would give me the knowledge and skills to share. And certainly I have been able to do both. So the course then was perfect in that regard. So there was so much information and learning, and every single day in the job I do is so diverse. I face so many challenges, from risk assessment, looking at accreditation, leading teams, completing safety, and supporting staff. And there's not a day goes by that my brain thinks so differently. I just use everything I've learned, and it's almost that I don't even realize it. It's when my colleagues say to me, "Oh my God, how did you come or write this report or bring forward this idea or respond to how we did that."
And Agnes, that was lovely the way you explained it. And as part of your clinical training, there often is not included on clinical programs any management skills, leadership skills, learning about quality and safety and risk management outside of the clinical risks that maybe you'd meet if you were a full-time clinician. And then as you went through your career and you moved out of the direct face-to-face, maybe patient interaction, and then became the manager of many, many staff. And you recognize that this course here at the Institute of Leadership would offer you a suite of skills that would help you to be more comfortable in your now very senior role that you hold currently, and over a large area within primary care and community care in Ireland.
Yeah, and with the change, in community care and the delivery of healthcare is changing so much. We've now launched a care project in Ireland, and we have the enhanced community care is how it's actually been delivered. And I'm so grateful that I've had the opportunity to share and work with all my colleagues from so many different backgrounds. And I realize that, you have only so much power as a clinician, and that to actually have the knowledge and the skills and to know how your actual organisation works and how it thinks and how you can actually contribute in a way that the organisation can recognise the language. So I didn't really know what I didn't know when I started the course. And now I have it's like earlier Pádraig was saying, having the confidence and having the language to be able to go to any meeting, now we're linking in with the hospitals, we're in relation to looking to how we're going to deliver the care as it's being shared out in the community here. So it's hugely beneficial in that regard.
Yeah, and that is lovely to hear. Any surprises? So
my surprise was that actually, to be honest, I saw the course as a destination, and I saw that if I had completed the course, I was done and dusted, and that was, and I had that information with me. But actually, it's a journey, and I realized that I myself and how I work and how I think have changed so much. But the big surprise for me is I coach and mentor some of my staff and help prepare people for interviews, and I use something from every module, the language, and to help them, and all that has really supported me. But it is actually, and now I'm looking around and looking to see where I can take my career now, whereas I actually saw it, as I said before, as the destination, but actually it's not. It's a journey to who knows where at this stage.
Yeah, and as that famous writer Stephen Covey says, you start with the end in mind. So on your first day at the Institute, you were thinking to graduation this November, but don't only think of it as a destination.
Exactly.
Enjoy the different modules along the way, enjoy meeting, enjoy your learning, bringing all that learning from year one together to year two when you do that substantial piece of work, when you implement a change in your organization, and then you write about it. Yeah, so that is lovely. As you said, that was a surprise for you to.
Yes, hugely.
And if you hadn't thought about, I need to stop and forget maybe about 2 years' time and enjoy where I am and enjoy the learning in the moment, you maybe wouldn't have got as much out of the course in the end. So that's actually lovely advice to give to all our listeners here this evening. Yes, keep the end in mind, a lovely master's in quality and safety and healthcare management, but also think of those steps along that journey and to reflect on those different steps and what you're learning along the way and how you can bring it to the workplace and how you can apply it, or maybe you can't apply it, and that's okay too, because of maybe the culture, your organization isn't ready for the introduction of some big change that maybe in some theory that we've talked to you about. Yeah,
and just the other thing was, it's just that now everything, like Pádraig had actually mentioned earlier, you're confident that your knowledge is evidence-based. And my year 2 quality project was aligned with the organisational policy. And now I had been invited then on to an audit committee because I had completed an audit. So I've learned so many skills. But one thing I would say is, as a person, how I look and how I think, and even from an academic point of view, you can quickly assess this, and you have the evidence, you've immersed yourself in the course, and what you put into it, you will reap the rewards hugely.
And that is fantastic. And then my very last question for you is, what advice would you give to somebody who's thinking about, wow, this quality and safety and healthcare management course sounds very, very interesting. So what advice would you give to somebody who's listening to us?
I would say to actually back yourself and to actually, to sign up to start the course, because you are, as I said, you're beginning a journey. Enjoy each of, and every module was a surprise. It was new learning, new information. So you were always constantly learning. So, and as Pádraig would say, I'm sure our modules and our assignments got better as we went along because we became more accustomed to the academia. But I would say actually, it had been quite a while since I had been in the world of academia. And to actually take that leap of faith, you get so much support, you're supported. Even the online, there's huge support. You're never alone. And there's what I loved about the class and what I loved about, even when we were online, was a great sense of trust. You could actually, you felt there was a sense of trust. You could ask your question. People shared and all want to help each other. So collectively as a community, the whole, the 2 years was so rewarding in that regard. So I would say, it's your destination, who knows? Yeah.
Agnes, thank you so much. And as I said to all the other students, where they are on that journey, whether it's the end of year 1 or the end of year 2. My thoughts are with you. We have an exam board coming up, and then you'll get those results that you're waiting for. So I wish you all the best.
Thank you so much. Yeah, thank you.
Then may I just say thank you to Dr. Jamal, to Rosita, to Padraig, to Dr. Shafia, and to Agnes. Each of you brought different perspectives on the program and what you've taken from the program, the advice you've given to people who are listening to us here, and the experiences that you had as part of studying with us here at the IOL. It was wonderful talking to you all again. So thank you.
Thank you.
So I'd like to hand back to Amy now.
Thank you so much, Kathy. Really appreciate that. And thank you to everyone who joined us today. Some really great insights and wonderful tips there. I love Padraig's tips about the end note there, and even giving us tips for applications. So well done. We have a couple of questions. What we're going to do now is Kathy's going to talk about project work in a few minutes. But first of all, I'd just like to ask, Dr. Jamal, Hashim, Dr. Shafia, Fatima, Agnes Flynn, Rosita, Gadira, and Padraig, would you mind just turning on your cameras there again, guys, and your microphones, just so we can get everybody up? Thanks, Agnes. That's great. And what we'll do is there's Shafia, thank you very much. And if you could just unmute yourselves as well, guys, that would be great. I'm going to start with first question, Agnes, because you just got one there a few minutes ago. So Agnes, we have one. Would Agnes suggest doing the course for junior CNM1? Is that clinical managers?
Yeah. Yes, I would actually. Because when you step up to a clinical nurse manager level, you find yourself in a position now of leading and managing teams, but also you find yourself responsible for audit, quality control, accreditation. So there's so many of them. Each of the modules in first year certainly all lend to your supporting you develop as a manager. But for me, at this early stage, it also brings you to outside your own discipline, which is so important, to learn from the others who are there, but will really give you a huge insight, because as you complete your modules and your projects of your organisation. So for me, I would certainly say, yes, it's a fantastic MSc to do.
Great, thank you, Agnes. We had another question there from, let me just see, from Zina Tarek, and I might just direct this to Dr. Jamal Hashim. Jamal, if you're there, is Jamal with us? No, maybe he's not. Okay, guys, I'm just going to direct this to the rest of you. So could someone please explain why should you choose this course over an MBA in healthcare management? If anyone has any response to that. No worries. We will. Oh, you do. Thank you.
I would just suggest that this course, that from my experience and from learning with the organisation, this course actually accredits you, will equip you rather than accredit you with the tools that's necessary for the, so not just from an operational point of view, it's so broad, it actually equips you with the information, the knowledge and the tools to actually, to meet the challenging and the changing needs of what is happening out in the healthcare development at the moment. There's huge emphasis now on value for money. And while that's important, and I'm sure in maybe MBAs, and I know colleagues who have done that, but to actually then work in an operational healthcare environment, it's certainly the value from this end is hugely additional onto that.
Great, thank you, Agnes. And we just have another one there. And Shafia, maybe you might be able to answer this because you are a doctor also. So we have a question from Pankaj Kumar, and he's asked, will I be able to manage the course along with my work? And if so, how will I manage that work-life balance, particularly, I suppose, being a doctor, and your hours can be long and extended, and sometimes you have to work long hours, and it's very hard to manage that work-life balance. So how did you manage, Shafia?
Yes, it's challenging, especially because we had this COVID going on. I mean, still there. So we had this added stress on us because of sometimes we had to work extra because of this COVID. Things would go messy, but we all did. We are all we are a group of from the Middle East. We were a group of 45, and we are all doing it. And it's how determined you are for this program. You have to keep time for your studies for sure, and you have to study every day to actually understand the subject, to understand what is being taught in the subject, and you can do it. It's challenging, but it's not impossible to do. And then there are weekends. So we since we started the program, we didn't have weekends. Then the weekends were for study. So this is how you, and besides it's online now, it was more flexible because we know from the previous students that they had to take extra time to attend the classes because they had physical classes. But for us, we were at workplace and we could easily log in the class, and there we were. So yeah, you can do that. I mean, we're all doing it, so I'm sure you can also.
Great. Okay, thank you for that, Shafia. And Pádraig, can I just put a question to you? How did you find moving from, the classroom into working online with COVID? What was that experience like for you? Would you have any tips for the students who are about to start?
Yeah, I think that was a very positive experience, Amy, because like I said, the support from the faculty staff in terms of navigating the virtual learning environment, the resources, all of that made it easy to transition. And also, I suppose, the technology is so good now. The class can be broken up into breakout rooms to discuss matters in smaller groups, which is also very helpful because obviously in the first year of the program, there were some paired assignments and some group-based activities as well. And while we would have done a lot of those in the classroom, there is no reason why they can't be done online in the breakout rooms and that kind of thing now. So I think the technology is a great assistance to be able to successfully interact with your colleagues online. And obviously in the second year of the program, then we had action learning sets, which were basically a small group, generally about 4 or 5 students in each group. And we had an academic supervisor who was, I suppose, giving or was overseeing our academic projects. So what we used to do at the action learning sets was to discuss where our projects were at, discuss with our colleagues any issues we were experiencing, trying to help each other figure out, I suppose, tips and techniques to unstick ourselves in certain situations if there was a particular problem that we had. Also, I would say we had established friendships as well in the course after the first year. So there was many a time I picked up the phone to ring Agnes to say I'm having this particular issue or I'm looking for an article on this, and what are you doing with that? Or so I think the support of your colleagues is very helpful as well to to engage with the course content and to be able to navigate any challenges that come up.
Great, thank you very much. And have we any more questions from our attendees, from our audience? I have one more question I'm going to ask Rosita because she's our only year 1 student, but we'll take any more questions if we have any more. I don't think we have. Rosita, I might just ask you, because you're a year 1 student, how did you find, I don't know when was the last time you were in college before you started with us in September last year, but how did you find, I suppose, the first assignment, or balancing the work-life balance between receiving your first let's say, assignments and
It's been a
deadlines?
while since I had participated in obviously a course of this level, so it took a little bit of balancing, from a time management perspective as well, to get through the workload that was assigned online. But one of the good things, actually, and it goes back to the question of how you get it done, they did signal how many hours were within each module and how many hours were required kind of each week in the course material that they gave down. So that did help balance it. And then I suppose getting through the first assignment, like everybody else has said, that if you were to look at the assignment from module 1 and then, kind of module 6, the progression, it is staggering on one level, and getting back into referencing and getting your head around that again. So look, there's plenty of resources there to help you through it. But it is a little bit of a challenge, particularly in that first module. But you do get there, and it's like Sophia said, that if you want it, if you're motivated towards it, you will you participate in it. But yeah, and then you find a rhythm and you get through it. And like that, it is broken down, so you've kind of got 3-4 weeks of, let's say, course material, and then you have the 2-3 weeks then to kind of work on your assignment, and you can balance it out that way as well. So
great. Thanks, Rosita. And sorry, just one final thing, and I think myself and yourself spoke about this on the phone only earlier today, but if you had any piece of advice for somebody starting in September, given the insight that you have now, what would you give to them? What piece of advice off the top of your head would you give
my
to them?
biggest, it would probably be to link in with the reference resource material that's there, because it does make it easier. There's plenty of it online, but then also with the librarians that are there, they're very, very helpful as well. So getting back into that now, unless obviously you're coming from one course to another, it may not be as applicable to you. But if you have been away from it, or if you've never engaged in it before, it can be quite tricky to find the rhythm of it and to understand it. So that would be one of the things that I would say to avail of. And it is included, there's an awful lot of it included in the 2 weeks of the orientation videos that are circulated out to you when you start. So that is good.
Great. Well, listen, thank you very much, everyone, for your contribution today. It's been a great insight, and this is one of the first times actually that we've done this. We've given this voice to the student journey for year 1 and year 2. So it's a great package for our future students down the line. I'm sure we'll have more questions after this. But before we wrap up, I'm going to hand you back over to Kathy, because Kathy's just going to talk about the project work for year 2, which she knows very, very well. So thank you very much, Kathy, and I will leave it over to you.
Thank you, Amy. A lot of the discussions and the questions that I put to the students referred to the year 1 in the programme. For anybody who's joining our programme this year in September 2021, we have a new programme, a new way in which the programme is being delivered. In September 2021, you will only have 5 modules in year 1 instead of the 6 that students in previous years would have had. And we are now bringing one of those modules to year 2. So that's where the 6th module is now going to be placed. And that module is the evaluation, measurement and research, which was a module that the students hadn't talked about. And we thought, in a timing wise, having this module now at the start of year 2, before you start that big piece of work, your year 2 dissertation project, it would be fresh in your mind what maybe research is about, what data is and measurement and evaluation is all about. So you'll do that module at that stage now in year 2. And then immediately, so that'll be in the month, say, of October of your year 2. And then in November in year 2, you're ready to start and to think about what is going to be that big capstone project. And I use that word capstone because it's about bringing the learning from year 1. And many students, they may, as part of their assignments in year 1, they have thought about, okay, is this a project maybe that I could do in year 2? And they may write about it in an assignment in year 1, and then they refine it. They make it maybe smaller because they want to go deeper when it comes to year 2. And in year 2, you do the planning, you look at the change management, because your project is, and this is what makes, I suppose, our program so different than MBAs, is that we ask you to implement in your workplace a project that will be meaningful. And for some students, it's a project at a high level. And for other students, it's a project that is very close to themselves and their team. But it's a change in the way that they do things. And that will mean that for the team and for the patients and for the organization, it will be a better place after the project has been implemented. So that's very much what year 2 is about. It's a different learning experience. You don't have the modules per se. However, you come in for days, and on those days, it's usually timed with where you would be as part of your project. And anybody who's just gone through year 2, I'm sure they would confirm that we tried to time each of those days, that this is maybe where you're writing your chapter 1. This could be the timing when you're writing your chapter 2, which is about what literature is out there that's going to support your project. And so we remind you about the skills of writing and reading literature and how to sort that literature within themes. And then day 3 is very much around, this is your chapter 3, like your methodology. So your change and how you're going to implement that change. And we have a session on that. Your day 4, which is, so you've collected your data, you've made your change, and how do you know that change has been successful? So we look at evaluation and what that means. And then your day 5 is about bringing it all together. So coming now to the end of your project and the report. So what was all your learning? And going back then to think about your module 1 and those aims and objectives that you set. And then what was your learning as you implemented that project throughout? So that's how year 2 goes for the students. And it's been very successful. We've had so many students over the years. And Pankaj, who talked about how difficult is it maybe to balance your very busy work life and your academic and being part of a 2-year program. The students we've here today are testament that they have completed year 1 successfully, and many of the students have completed year 1 and year 2 successfully. So how they managed, and students manage in different ways. Some students may like to do a little bit every day. Other students maybe like to say, I wonder, can I block off some days and use that as part of my learning? But there was a beautiful bit of advice that one student gave: get into the rhythm that will work for you. And it then becomes a habit in how you can carve out those times as part of your study and the achievement of your MSc from RCSI, the Institute of Leadership. So back over to you again, Amy.
Thank you so much, Kathy. That was so helpful and really insightful for our students and our attendees. So I just want to say a thank you again to everyone who participated today, to Cora, to Agnes, to Shafia, to Jamal and Rosita, and of course you, Kathy. As always, you've been excellent ray of sunshine and some great answers there from everybody and some great insight and information on the project work that will be a part of the IOL program. I'd just like to say, if I've just sent some messages there in the chat, if you have any questions regarding any of our master's programs or professional development programs, please email us at leadership@rcsi.com, or you can go to www.rcsi.com/leadership/study. That will give you more insight. But we do have a panel of recruitment advisors based in the Middle East and in Ireland, and we are more than happy to answer any of your questions coming forward. So once again, thank you to our student panel and to Kathy, and we will leave it at there, folks. Thank you so much. Take care and have a lovely evening. Okay, bye-bye.
Thanks, Amy. Bye.
No
Bye to
problem.
everybody.